Between the proximal and distal end, there is the shaft of ulna, to which several muscle attaches. If you look closely, it is thicker around the neck at the proximal end and it tapers distally. It has three surfaces: anterior, posterior, and medial. It also has three borders: posterior border, anterior border. Moving a little sideways, there is the interosseous border. The interosseous border is sharp at the lateral side and makes the interosseous membrane that attaches radius and ulna to each other, as you can see here. Because of this bridge, this area is known as the interosseous border. Talking about the anatomical landmarks, there are two crests towards the posterior side to which the muscles and fibers attach. First one is the supinator crest of ulna. The supinator crest is just superior to the interosseous border and serves as the origin for the supinator muscle. The longitudinal crest. The longitudinal crest divides the posterior surface into two portions: a posterolateral face, which can be a side facing towards the screen, and the anterolateral face, which is facing opposite to it. Just below the supinator crest, laterally, there is a hollow depression known as the supinator fossa that provides the origin of fibers of the supinator muscle. Looking down to this, there is a second smaller fossa can be found for the flexor pollicis longus. In the midway of ulnar shaft, there is a nutrient foramen. This controls the bone growth from 7th intrauterine week up to the 11th years of age. It is covered by the flexor digitorum profundus muscle.